I think over the last years now, we are becoming more and more aware that in addition to disease-modifying treatment by a drug, that in addition to that, that maybe we are also able to modulate the disease course, at least partly by lifestyle changes.
Often you're collecting this data retrospectively and you're expecting people to try and remember what was their diet like, what was their activity like. I guess it helps overcome some of those limitations if it's more being recorded in real time.
In general, you can say that a healthier lifestyle with an adherence to a healthier diet, that may improve their symptoms. Hi everybody, my name is Brigit de Jong. I'm an MS neurologist and I'm working in the Netherlands. I'm working at the MS Center in Amsterdam and I'm doing clinical work, research and teaching on MS.
And I'm Brett Drummond. You're listening to the ECTRIMS podcast, the official podcast from the European Committee for Treatment and Research in Multiple Sclerosis. For many years now, there has been significant interest regarding the role that diet can play in the management of MS. For people living with MS, it is seen as a way that they can take control of their disease on a daily basis. It has seen the rise of many so-called MS diets that promote the consumption or avoidance of different foods. However, there is debate around the evidence basis for some of these claims, and the concept of an ideal diet is hotly contested. My guest in this episode, Brigit, performs research that focuses on non-pharmacological interventions, including diet, that determine the clinical outcome and pathogenesis of MS. Together, we will be discussing the latest evidence for the benefits of dietary modifications in MS, as well as discussing how they should be communicated and implemented by neurologists. Brigit, thanks for joining me.
Yeah, thank you so much.
So I think to get started, let's start with the very basics of this. Broadly, what has research told us about the role diet can play in the management of MS?
Yeah, so I think we have to split that in either how it's related to the risk of developing MS, and there we see that genetics and environmental lifestyle factors, but also lifestyle that they determine the risk of MS. But as soon as people have developed MS, they are really curious and they feel like, in addition to my medical treatment, how can I get more control back over my health and my life? So really often in our outpatient clinic, but also on websites and in books, you read a lot about MS and diet. And I think since we have some indication that it might influence the disease course as well, it's really important to focus on that.
Yeah, and I think it's a really good point in terms of the distinction we make in terms of how we talk about this. And I know your group recently published about the effect that diet can have on the onset and the risk of developing MS. So maybe let's start with that. What has the research shown in terms of that?
Yeah, so we see that either younger age, so in childhood, but also when people are growing up, and also obesity, that these factors are associated with an increased risk of developing MS, and that you see that people who have a less healthier diet, that they have a higher risk during childhood, and they have a higher risk to develop MS when they are growing up. And a healthier diet, that it seems to be beneficial for having a less and reduced risk to develop MS. And also obesity, that is associated with an increased risk. But the thing always is then when you look back, then you really have to be aware of it as well, that maybe these data may be biased due to the fact that people start to think about, oh, now I developed MS, what did I do during my childhood may have this influence my risk. But there are quite some data that show that there's a relationship, yeah.
Yep. Is there any way that we're able to easily separate diet and obesity as risk factors? Because obviously, I mean, there are different ways that a person can have a high BMI. Obviously, diet is the most common, or one of the most common ways to lead to that, but also we have activity and exercise. Is there anything, so it's possibly a really hard question to answer, but can we separate those two?
Yeah, that's a really hard question, and it's really hard to separate, because in general what we see is that people who adhere to a healthier lifestyle and they have MS, that they are doing better as compared to people who are having a less healthier lifestyle. And the thing is that if you start to cook healthier, maybe you feel more in control, and then you think, oh, let's do some exercise as well, and maybe I should quit smoking. So it's really hard to unravel how all these different factors are intertwined, because we also know that people who smoke less, then in general they also have a healthier lifestyle. So it's if you really need a huge amount of participants to unravel how these different things are related to each other. But for example, to quit smoking, there's quite some evidence that that's beneficial on your MS disease scores.
I guess in terms of, I completely agree with you around the numbers of patients you would want here to be able to really understand these things. We've obviously seen, especially over the past 10 years, a number of global databases or local registries start to collect this data. Are many of those collecting dietary information as part of the routine clinical data that they're inputting? And if not, do you think that's something that would be worthwhile?
There has been some data collected on diet. I don't think in the large databases that has not been sufficiently collected yet. I think over the last years now we are becoming more and more aware that in addition to the disease-modifying treatment by a drug, that in addition to that maybe we are also able to modulate the disease scores at least partly by lifestyle changes. And that we see that a healthier lifestyle, that in general it's related to better outcomes. But I totally agree with you that it would be really great if also in the large databases we should add more this kind of information, but also factors like comorbidities. Because, for example, but also just adding, is that person smoking, yes or no? Did it quit, yes or no? But also comorbidities like cardiovascular diseases are associated with worse disease outcome. So if you see that people get, a certain group of people get worse as compared to other people, then it's also important to add this into your analysis and into your hypothesis. So it's true that I am thinking about it to collaborate more with people on this topic and try to generate more data.
Mm-hmm. I mean, as you say, I think one of the things you said earlier is around one of the limitations. Often you're collecting this data retrospectively and you're expecting people to try and remember what was their diet like, what was their activity like. I guess it helps overcome some of those limitations if it's more being recorded in real time.
Yeah. So you prefer prospectively to collect data and not to be biased by thoughts you have, like, oh, maybe due to a good or bad diet, maybe this is the reason that I developed this. But still, these retrospective data are, of course, also can generate important information, but you should be aware of the limitations as well. Yeah, so I think there's still a lot to explore.
Definitely. I think this is a topic we'll be discussing for a while. I think we can't talk about this topic without talking about so-called MS diets. We've seen a lot of them promoted that all have differences in terms of what they're recommending. In terms of the research behind them, is there any evidence to suggest that a particular diet is especially effective for people living with MS?
And so if you look at the large, for example, Cochrane reviews on this topic, then you see that the final conclusion is that there's still not enough evidence which specific diet might be helpful for MS. But overall, if you look from a broader distance, then you see that the components that are added to these different diets and are associated with better outcomes, then you see that it's in general more a healthier diet. And so I think something we can learn from is that you look more at the similarities than the differences. But so far, it's true, quite some diets have been investigated in relation to MS, and sometimes it's more like an observational study that a large group of people with MS has done it, or more personal stories of people. But there has been, most evidence has been on Mediterranean diet and on ketogenic diet, and there has been some evidence on time restricting eating. These are the most evidence ones. And if you look more on the side effect side, like, what's quite harmless or anyway it's good, then the Mediterranean diet, beside, of course, for MS, it has been proven to be beneficial for quite some chronic diseases like cardiovascular diseases. And on the other side, there has been some evidence on ketogenic diet as well. But then you have to be more aware about potential side effects. I'm not saying that if you do it in the right way that it's always bad, but then you have to be aware that things like, for example, calcium and magnesium might not be sufficient in your diet. So at least here in the Netherlands, people recommend that if you do, for example, a ketogenic diet, then you should do it guided by a dietitian. And the same holds true for time-restricted eating. Then you really should be aware that you eat enough. And so that's also more important, to be guided by a dietitian. And on the other side, Mediterranean diet is beneficial and healthy for everyone. So if you feel like, what can I do myself? Then with the evidence we have today, I would suggest to look at the Mediterranean diet.
A question that I don't think there will be a research data to back this up, so this is more an opinion-based question, but as someone who works in this, very interested in your opinion on it. We obviously know with DMTs that there is very much a case of finding the DMT that works for each individual. We know that not every person living with MS will respond the same to each therapy, and it's about finding. Do you think diet is a little bit the same, especially when we drill down to the specifics of it, that it's about finding the diet that works for a person, which I think is probably a combination of one that provides them with the benefits, but also adherence, because a lot of these diets can be quite restrictive, and that makes it difficult to continue to follow it?
Yeah. I think there might be some individual differences as well, like which one might be the best for you. If you look at the more, for example, at Mediterranean diet, it has a positive. So in general, diet is the most important factor that determines the healthiness of your microbiome, your gut microbiome. And so if you have a healthier diet, and also some data have shown for Mediterranean diet, then you see that the diversity and of your microbiota improves, and that's related to a healthier microbiota. And these, your microbiome is really influenced quite importantly your immune system. So it can be either influence in the direction of a more pro-inflammatory, so the profile, or an anti-inflammatory profile. And we know that there's quite a lot of interaction between the the gut and the brain. And also in general for brain health, you see that a healthier diet in connection between your gut and your brain, that it may improve your brain health in general. So not specifically for MS. And it might be beneficial for neurodegenerative diseases in general. So if you ask me like, is there one specific diet that might be better for one individual with MS? I think there are some diets that are so much influence on so many different factors that I think it might be helpful, beneficial for everybody. I know that some people with MS they keep asking me like, what about milk products? Are they beneficial or do they harm me? Because personally, I feel I get worse when I use this. So I think the first step should be that we really look at a diet more in general. And then the next step can be that you pick out some different topics of this diet and to research more in detail or maybe in parallel to these investigations on the diet in general to see if we can better define it on an individual level.
Yeah, I completely agree. And I think there are some things around how we communicate some of the research about diet and specific parts of diets that we need to be really mindful of, because often there can be very preliminary studies or very small studies that get communicated, like we've seen ones before about cow's milk and how it may affect progression. But, this was a very small study. But as soon as that gets communicated, you get the sort of response that you're talking about, where all people living with MS who are certainly interested in dietary modification as part of the management plan start thinking, do I need to cut milk out completely? So I think that's part of that. I think the gut microbiome is also particularly interesting. And in the same way as I don't think we know what the ideal diet is, we probably don't also know yet what the ideal gut microbiome is, but there's certainly interest around how do we use diet, or is there a future where we can use diet to modulate the gut microbiome?
And there are also some discussions going on like, are we able to modulate the effect of certain disease-modifying drugs? Can we improve their efficacy related to diet? So it can also make each other synergistically can improve both effects. So that's also pretty interesting.
And so sort of beyond, obviously, gut microbiome is one of them. Do we know much else around the mechanisms by how diet impacts on MS? Beyond, I think, probably a lot of the things that a lot of these diets have in common, other than being healthy, balanced diets, are that they promote what we might call anti-inflammatory foods. Is that sort of the key mechanism that we think that this might be beneficial?
I think it's one of the key mechanisms, and I think at least a part of it is might be due to the connection between the microbiome and the immune system in the gut. But we also see that if you look, for example, at lipids in the blood, then you also can see that diet also modulates these factors. So it might be partly independent of the gut microbiota. I actually think so, but that's really hard to prove. And so that's more the inflammatory part. On the other side, we also know that MS has neurodegenerative characteristics, and that might be partly related to smoldering inflammation, but also maybe more directly to neurodegeneration. And for example, some studies in the animal model for MS have been done on time-restricted eating, and there we saw that the mice who were on a time-restricted diet, that they looked in the spinal cord, that, for example, their cytokine profiles were anti-inflammatory, and the Tregs were more present, but also some neurodegenerative characteristics were reduced. So it might not only be due to inflammation, but also maybe partly due to neurodegeneration.
Yeah, and I think there's some really interesting work around that, especially, as you say, with intermittent fasting. And we've seen in preclinical that it can promote remyelination. Work out of the University of Cambridge, who are now have also mimicked that in the preclinical setting using metformin, now going through phase 2 clinical trials of metformin and clemastine in people living with MS, and we're interested to see if that will promote remyelination. I think we're expecting those results later this year. So it will be interesting to see what happens with that, and then if that's followed up, I think, with an intermittent fasting study itself.
Yeah, there has been a small pilot study in people with MS on intermittent fasting, and it seems you have all different kinds of options, so that you don't eat for example, 2 days a week and the other days you eat, or certain hours a day that you don't eat. And it seems feasible to do, but I think longer data are really necessary to investigate if people are also able to hold on this for a longer time. So with all these dietary interventions, it should be feasible for a longer time. Otherwise, we can design a really perfect diet. But if people are not feasible to hold on this for a longer time, then in daily life, it makes it's not that helpful anymore. And there has been a small pilot study on intermittent fasting in people with MS, and these data showed that the people who were able to do it, that they had a better quality of life, reduced disability, and reduced MS-related symptoms. So it's not. There's not sufficient data yet that we can say, that's how it works, but there's some promising data on it.
And I think it comes back a little, especially with those, back to what you were talking about earlier in the episode around some of the side effects. And I think when we talk about intermittent fasting, where we talk about caloric restriction in a population of people who we know suffer from fatigue, suffer from impaired energy production, that we need to be mindful of that.
And maybe I can add one other comment to it, that sometimes people feel like, I really have to adhere myself to a certain diet. And if they notice then that they feel worse, or their symptoms get worse, or the disease progression gets worse, then some people start kind of punishing themselves. Maybe I didn't do it good enough, and maybe I should even be stronger. And I think what you're saying, you should be more mindful to yourself, be more resilient, and it should be a diet that makes you feel also more calm, because we also see that stress-related factors also at least may influence your MS-related symptoms. So I think if you choose a diet, it should be really something that fits to yourself and makes you feel better. And if you feel like, I really should do this, but I actually prefer to do some different things, then you should reconsider what you are doing.
To finish up, I've got 2 questions that I might ask at the same time, because I think for a lot of people listening to this episode who maybe this isn't their area of expertise in terms of research areas, talking about diet with patients who come and see them may not necessarily come easily. It's a topic we all know that we need to talk about, but knowing exactly what to say in that space and not saying the wrong thing, I think can often be a little difficult. So I think, one, what is your message, or what would you recommend to neurologists and healthcare professionals in terms of discussing this topic with their MS patients? And probably as part of that answer, when you have conversations with your MS patients around this, what do you communicate to them? What are your key messages?
Yeah. So what I already mentioned in the beginning, and in my outpatient clinic, then really often people ask me like, doctor, what do you think about diet? am I able to influence my disease progression by diet, or am I able to modulate my symptoms, the burden of the disease by diet? What do you think about it? And then what I say is that today, with the knowledge we have today, that there are sufficient evidence that if you have a healthier lifestyle, then your MS-related symptoms are in general better. And there are some smaller evidence that it also may modulate the disease progression. The mode of action, how it mechanistically determines these outcomes, that still needs to be investigated, because the relationship between that people have less MS-related symptoms and they feel better, that might be due to also just, for example, that they start having a healthier lifestyle, doing more physical activity, doing more exercise, feeling better. So also the mental, psychological factors may determine this outcome. But in general, you can say that a healthier lifestyle with an adherence to a healthier diet, that may improve their symptoms.
And also, I think importantly, reduce comorbidities, which we know are also more prevalent in people living with MS.
Yeah, right. So in addition to having a healthier diet, there's also quite some evidence on physical activity that at least the symptoms, the people who are more physically active, that that's good for their symptoms. So, but also quit smoking, and also as a healthcare provider, we should be more aware of the comorbidities of people with MS, because we see on the data that people who have more comorbidities in addition to their MS, that they also have a worse disease progression. So I really think that in addition to the medication, you also can add something on lifestyle.
Well, look, thank you very much, Brigit, for joining me today for this really fascinating discussion on what I think is a really important topic, and one that we discuss and that we keep open the conversations between this and people living with MS, because we know it is so interesting to them, but it's important that the conversations are guided by the evidence, and I think you've done a really great job of walking us through that today.
Thank you. It's a great honor and pleasure to do this, and I really hope that this will improve the people with MS.
And thanks everyone for listening. Once again, I'm Brett Drummond, host of this podcast episode and co-founder of MSTranslate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community. The ECTRIMS podcast is produced and hosted in collaboration with two key partners, MSTranslate and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The 2024-25 ECTRIMS podcast series is supported by educational grants from Alexion AstraZeneca Rare Disease and Novartis. Educational grant providers have no input in the podcast content. You can read more about the topic of this latest podcast episode and more on the ECTRIMS website, ectrims.eu. Do subscribe to the ECTRIMS podcast on your favourite podcast channels, and follow ECTRIMS on X, formerly Twitter, LinkedIn, Facebook and YouTube.